Now we go to the transporting points according to the season of 5 elements. Chapter 44 of the spiritual axis gives guidelines as to the use of the 5 transporting points according to seasons. It says in winter, use well points. In spring, use the spring points. In summer, use the stream points. In late summer, use the river points. In autumn, use the sea points. These rules find only limited application in clinical practice, as it is not always possible to choose points according to the cycle of seasons, as this choice might conflict with the requirements of the treatment according to the actual condition of the patient. However, these guidelines may be followed more when giving preventive seasonal treatments to patients who seek treatment to keep well rather than for specific conditions. Chapter 61 of the Simple Questions discusses the use of the 5 transporting points according to the season. In autumn, use the river points to drain yin pathogenic factors and the sea points to drain yang pathogenic factors. In winter, use the well points to subdue rebellious yin qi and the spring points to strengthen yang qi. These instructions, in contradiction with those from chapter 44 of the spiritual axis, are not widely followed. 5 transporting points according to season. Summary, we have the well points in winter, spring points in spring, stream points in summer, river points in late summer, and sea points in autumn. According to the 5 elements, the 5 transporting points are also used according to their 5-element character. This was established in the Classic of Difficulties for the first time. In chapter 64, it says that the yin channel's well point belongs to wood and the yang channel's well point belongs to metal. The use of the 5 transporting points according to their 5-element character is discussed in chapter 69 of the Classic of Difficulties, with the terse advice in case of deficiency, tonify the mother; in case of excess, drain the child. Following this principle and keeping in mind the generating cycle of the 5 elements, in case of deficiency of a channel, we can choose the point on that channel corresponding to the mother element in order to tonify it. In case of excess, we would choose the point corresponding to the child element in order to drain it. For example, if the liver is deficient, the liver belongs to wood. Water is the mother of wood. We therefore select and reinforce the point liver 8, which corresponds to water. If the liver were in excess, we would choose and reduce the point liver 2 corresponding to fire, as fire is the child of wood. Table 50.2 lists the tonification and draining points according to the mother-child relationship in the 5 elements. So for the lung channel, the mother, to tonify, we use lung 9. And if there is an excess, we drain using lung 5. For the large intestine, to tonify, we use LI11, and to drain LI2. For the stomach, to tonify, we use stomach 41. To drain, we use stomach 45. For the spleen, to tonify, we use spleen 2. And to drain, we use spleen 5. For the heart, to tonify, we use heart 9. And to drain, we use heart 7. For the small intestine, to tonify, we use small intestine 3. And to drain, small intestine 8. For the urinary bladder, to tonify, we use bladder 67. And to drain, we use bladder 65. For the kidney, to tonify, we use kidney 7. And to drain, we use kidney 1. For the pericardium, to tonify, we use pericardium 9. and to drain, we use pericardium 7. For the triple burner, to tonify, we use triple burner 3, and to drain, triple burner 10. For the gallbladder, to tonify, we use gallbladder 43, and to reduce, gallbladder 38. For the liver, to tonify, we use liver 8, and to drain, we use liver 2. In accordance with this theory, therefore, every channel has a tonification and draining point corresponding to its mother and child element, respectively. It must be stressed, however, that the needle technique is all important when tonifying or draining, that is, reinforcing method to tonify and reducing method to drain. In other words, we cannot rely only on tonification or draining character of a point in order to tonify or drain. Thank you for your attention.
Let's now discuss Lung 9, source point. Lung 9 is located on the ventral aspect of the wrist at the level of the wrist joint space, the most distal wrist crease, on the radial aspect of the radial artery and ulnar to the tendon of the abductor pollicis longus muscle. So how to find Lung 9? As the location of the wrist crease varies, the ventral joint space between the proximal row of carpals and the radius ulna is a more reliable landmark for orientation. By loosely moving the hand, the joint space is easily palpable. Palpate the radial artery by means of its pulsation on the radial side and locate Lung 9 on its radial aspect. Located on the same level are pericardium 7 between two tendons and heart 7 radial to the insertion of the tendon of the flexor carpi ulnaris on the pisiform bone. Needling of Lung 9 is vertically 0.2 to 0.5 tsum. Caution, you have to avoid the radial artery. If the needle is pulsating, which is the desired effect, no need of additional stimulation. For actions and indications of Lung 9, strengthens the lung, transforms phlegm, descends lung qi, regulates and harmonizes the vessels. So this is the relationship between zong qi and blood circulation. Lung 9 opens the channel, alleviates pain. Special features: Yuan source point, shoestring point, earth point, tonification point, Hui meeting point of the vessels, important point for tonifying the lung qi and yin, especially with chronic disorders. Lung 9 is another major point of the lung channel. It is the main point to tonify lung qi and lung yin, especially in chronic conditions. Being the source and tonification point, it is eminently suited to tonify the lungs in deficiency conditions. We use Lung 9 more frequently in deficiency rather than excess patterns, and for interior rather than exterior conditions. However, as its indications show, it can also be used for excess patterns. Use Lung 9 to resolve phlegm obstructing the lungs, but in chronic more than acute cases with chronic cough with sticky sputum. The chest is the seat of the gathering qi or zong qi, which is closely related to lungs and heart. Lung 9 tonifies gathering qi of the chest and can be used in patients who are particularly qi deficient, suffer from cold hands, and have a weak voice. These last two are signs of gathering qi deficiency. When tonifying gathering qi, Lung 9 is combined with Ren 17. Lung 9 is also indicated when all the pulses are extremely weak and deep and nearly impossible to feel, an indication that is related to its function of controlling all blood vessels. Lung 9 is the gathering point of all the blood vessels. The classic of difficulties in Chapter 1 says, the inch mouth, which is the front position of the pulse corresponding to Lung 9, is the great meeting place of all the blood vessels, and the lungs give impetus to the pulse. The front position of the pulse is considered the convergence point of all the blood vessels of the body, and for this reason, the acupuncture point on its site, which is lung 9, is said to influence all the blood vessels and the pulse. It is because of this nature that we feel the pulse on the radial artery, which overlies the lung channel. It is not by chance that this position was chosen as the best place to feel the pulse. It is because the lungs govern qi, and one can therefore feel the movement of qi within the blood at this position. Lung 9 can therefore influence all blood vessels and can be used for poor circulation, cold hands and feet, chilblains, and varicose veins. The lungs' influence on the blood vessels is a further expression of the close relationship existing between the lungs and heart. The lungs govern qi, the heart controls blood, and they mutually affect each other. Lung 9 tonifies lung qi and stimulates circulation of heart qi and blood in the chest. It is therefore also used to tonify heart qi and blood indirectly in such symptoms as breathlessness on exertion, listlessness, and palpitations. Lung 9 can be used to clear lung and liver heat in cases when liver fire overflows towards the chest, obstructing the descending of lung qi. It is useful to compare the actions of lung 9 with those of lung 7. So lung 7 is used for exterior problems, excess patterns, and has an outward movement, and it affects qi. While lung 9 is mostly for interior problems, for deficiency patterns, has an inward movement, and affects qi and blood. So lung 7 is for channel problems, better for emotional problems, good for acute conditions, opens water passages, and affects the bladder. While lung 9 is not so much for channel problems, not so much for emotional problems. It is more for chronic conditions, does not open water passages, and does not affect the bladder. Summary of functions: lung 9 tonifies lung qi and lung yin, resolves phlegm from the lungs in chronic cases. It tonifies gathering qi or zong qi, and therefore lungs and heart, and it affects all blood vessels. Thank you very much for your attention.
Today we discuss about the use of Lu points according to their energetic influence. So we use the connecting points according to manifestations on the skin. The spiritual access also says in chapter 10 that when the connecting channels are full, they can be seen. When they are empty, they cannot be seen. This is due to the fact that the connecting channels are more superficial than the main channels and branch out into the smaller branches of the superficial and minute channels. In full patterns, the connecting channels and their smaller branches are congested and can therefore be seen. A greenish coloration suggests stagnation in these channels. A bluish color indicates cold. A reddish coloration suggests heat. And a purple color indicates blood stasis. The channel pathway areas should also be palpated, and they can feel cold or hot to the touch. This, together with the coloration, indicates retention of cold or heat in the connecting channels and their branches, that is an excess condition. In deficiency patterns, the connecting channels and their branches are void of qi, so nothing can be observed outwardly in terms of color, but in chronic severe cases, a flaccidity of the muscles can be observed. In excess conditions of the connecting channels, the connecting point must be reduced, and in deficiency conditions, it must be reinforced. In case of venule and capillary congestion manifesting with macules and a connecting channel, these blood vessels can be pricked and bled. So to summarize, the use of connecting points according to their energetic influence. One, we use the connecting points to affect the superficial areas of a channel in tendinomuscular problems. Second, connecting points are used to eliminate stagnation of qi and or blood in the connecting channel areas. And third, connecting points are used to drain or tonify the superficial connecting channels according to manifestations on the skin. Obviously, apart from the above uses, the connecting points are also often used in practice according to their specific action, irrespective of there being connecting points. For example, stomach 40 is very much used to resolve phlegm, irrespective of it being the connecting point of the stomach channel. Triple burner 5 is often used to expel wind heat. Pericardium 6 is very much used for chest problems and emotional problems. Lung 7 can be used to affect the head, and so on. So there are 6 ways of using the connecting points. First, in conjunction with the source point of the primarily affected channel to reinforce its action. Second, according to the full MT symptomatology from chapter 10 of the spiritual axis. Third, according to their range of action in terms of energetic layers, that is to affect the superficial layers in channel problems. Fourth, for stagnation of qi and stasis of blood in the connecting channel areas. Fifth, to drain or tonify the connecting channels according to manifestation on the skin. And finally, according to their specific action, irrespective of being connecting points, as stomach 40 is used to resolve phlegm. Thank you for listening.
Now we go to the back transporting points. The bladder 15, HEART-SHU. The bladder 15 location is 1.5 tune lateral to the posterior midline on the level of the lower border of the spinous process of the fifth thoracic vertebra, or T5. How to find? First, we need to locate the spinous process of C7. From there, count down 5 spinous processes to the lower border of the spinous process of T5. Measure 1.5 tune lateral to locate bladder 15 on the highest point of the paraspinal musculature. Or with the patient seated and their arms hanging down, the spinous process of T3 is generally on the level of the easily palpable medial end of the scapular spine. From there, count down 2 spinous processes in an inferior direction to the T5. Locate bladder 15, 1.5 tune lateral to the midline. Located on the same level are do 11 on the midline, a point of EXB2, 0.5 tune lateral to the midline, and bladder 44, 3 tune lateral to the midline. Okay. Sa needling, 0.5 to 1 tune obliquely towards the spine. In clinical practice, this point is often needled transversely, subcutaneously towards the spine. This allows the patient to lie in a supine position during needling retention. The needles can be secured with tape. Caution is pneumothorax. For the action and indication, this bladder 15 tonifies and nourishes the heart, regulates the heart chi, unbinds the chest and removes blood stasis, calms the shin, clears fire, moves chi locally and along the channel pathway. For example, for disorder of the thoracic spine and intercostal region. For these special features, bladder 15 is the back shoe point of the heart. Bladder 15 is a very important point for many heart patterns. Firstly, it calms the mind and can be used for nervous anxiety and insomnia, mostly deriving from excess conditions of the heart, such as heart fire or heart empty heat. In these cases, it is needled with reducing method. It also calms the mind by nourishing the heart, and for this reason, it is used for poor memory and insomnia. At the same time as calming the mind, it also stimulates the brain if used with reinforcing method or with direct moxibustion. In particular, used with direct moxibustion, it has a good effect in stimulating the brain and is effective for depression, mental confusion, and poor concentration in adults and slow development in children. Bladder 15 also moves qi and invigorates blood and is therefore used for pain and chest deriving from stasis of blood. Bladder 15, the summary of functions, it calms the mind, anxiety, weeping, fright, insomnia, excessive dreaming, manic depression. Nourishes the heart, disorientation, delayed speech development, poor memory, poor concentration, mental confusion, heart qi deficiency in children. Stimulates the brain, clears it, regulates heart qi, and invigorates blood, heart pain, fullness of the chest pain, palpitation, irregular pulse. Bladder 15 is the bakshu point of the heart, where qi of the heart emanates from the interior to the body surface and in common with all the bakshu points, especially those of the yin sang. Bladder 15 has a strong action on regulating and tonifying its corresponding sang fu at the deepest level. It is used equally to tonify deficiency. The heart is unique and among the sang fu in that it commonly suffers from all the four main kinds of deficiency: blood, yin, qi, and yang. And to resolve excess pathogenic factors such as blood stasis, heart fire, and obstruction by phlegm. The heart controls the pulse, and when heart qi is deficient and is unable to regulate the blood, there may be palpitations or regular pulse, especially if the heart blood is also deficient. In the latter case, palpitations will be more likely to be accompanied by anxiety, in contrast to the palpitations caused purely by qi deficiency, which are usually unrelated to emotional changes. In fact, palpitation may accompany any pattern of heart disharmony, whether excess or deficient, and in all these cases, bladder 15 may be selected. The heat clearing action of bladder 15 finds its most important expression in the treatment of excess type psycho-emotional disorders. When the heart fire rages out of control, it agitates and excites the spirit, leading to such symptoms as severe insomnia and excessive dreaming. When heart fire combines with phlegm and obstruct the portals of the heart, there will be severe disorder of the spirit such as epilepsy, dementia, mad walking, and mania depression. The heat clearing action of bladder 15 extends beyond the heart itself, and the illustrated supplement of the classic of categories states that bladder 15 is one of the 5 points, bladder 13, bladder 15, bladder 18, bladder 20, and bladder 23, which drain heat from the 5 sang. Seminal emission may present in a number of different patterns and is broadly differentiated into seminal emission accompanied by dreaming and seminal emission without dreams. Seminal emission with dreams may be due to heart fire, heart and spleen deficiency, heart and kidney deficiency, ministerial fire, or damp heat. Even in cases where the heart is not directly involved, However, if seminal emission is accompanied by erotic dreams, bladder 15 is indicated. Finally, in common with most of the yin back shu points, bladder 15 is able to treat the issues and sense organ associated with its corresponding sun. The tongue is the sprouting forth of the heart, and bladder 15 is indicated for slow speech development in children and lack of strength in the root of the tongue. Bladder 15 is also indicated for lacrimation and eye pain. This indication, however, reflects disorder of the heart channel rather than the heart song. Thank you for your attention.
Let's now discuss a front collecting point or mu point called liver 13, completion gate. Liver 13 is located anterior and inferior to the free end of the 11th rib, approximately 1 sun superior to the umbilicus. How to find? First, we have the quick method. Ask the patient to press their flexed elbow 90 degrees against the lateral aspect of the thorax, and the tip of the olecranon will be pointing to the free end of the 11th rib. Liver 13 can then be located on its anterior and inferior border. Or place the hand on the upper abdomen and with gentle pressure, palpate along the lower border of the rib cage until you can feel the free end of the 11th rib just superior to the umbilicus. Locate liver 13 on its anterior and inferior border. Located on approximately the same level, 1 sun superior to the umbilicus are Reynaud on the midline and stomach 24, which is 2 sun lateral to the midline. Gallbladder 25 is located more laterally and inferiorly at the free end of the 12th rib. Needling 0.5 to 1 sun vertically or better obliquely in the lateral direction. Caution, peritoneum, hypertrophied organs, right, the liver, the left, and spleen. Actions or indications of liver 13. Harmonizes the liver and the spleen, regulates liver qi, especially the middle and lower burner, strengthens the spleen, opens the channel. Special features: front mu point of the spleen, meeting point with the TAIYUAN and the gallbladder channel, Hui meeting point of the Zhang organs. Liver 13 is very much used whenever liver qi stagnates and invades the stomach and spleen, preventing spleen qi from ascending, resulting in loose stools, diarrhea, abdominal distension, and stomach qi from descending, resulting in retention of food, belching, and fullness in the epigastrium. The use of this point will promote the smooth flow of liver qi and eliminate stagnation, as well as strengthen the spleen. It is therefore the main point to use whenever liver and spleen are not harmonized. Typically, the pulse is wiry on the left and weak on the right. Needled with reinforcing method, this point can also be used to tonify stomach and spleen. If moxa is used in addition, it can tonify and warm the spleen in spleen-yang deficiency. Summary of functions: promotes the smooth flow of liver qi and harmonizes liver and spleen. Manifested as hypochondrial distension, pain in the ribs, abdominal distension and pain, diarrhea, undigested food in the stools, borborygmi, and constipation. Liver 13 tonifies stomach and spleen. If moxa is used in addition, it can tonify and warm the spleen yang. Liver 13, located midway between the middle and lower jaw, is both a point of the liver channel and the front mu point of the spleen. The term mu means to gather or to collect, and the front mu points are where the qi of the Zhangfu gathers and concentrates on the anterior surface of the body. Liver 13 is therefore an important point to harmonize relationship between the liver and spleen and between the middle and lower jaw, with emphasis on disorders of the abdomen and intestines. According to standards of patterns and treatments, the essence of the 5 Zhang is all transported from the spleen, as the origin of the postnatal qi, spleen and stomach are considered to play a central role among the Zhangfu, transforming and distributing the essence of food and drink throughout the body. For this reason, spleen may be said to dominate the Zhang and the stomach the Fu. The close relationship of liver 13 to the spleen, therefore, is further reflected in its status as the Hui meeting point of the sun. In the same way that Ren12, the front mu point of the stomach, is also the Hui meeting point of the Fu. The liver tends to excess patterns and the spleen to deficiency. Liver-spleen disharmony may originate either from the liver, when qi stagnation aggressively invades, obstructs, and suppresses transformation and transportation function of the spleen, or from the spleen, when spleen qi deficiency is unable to resist encroachment of exuberant liver qi. This process is reflected in the saying, anger is hard and the zangfu are soft. What is hard easily injures what is soft. And by Zhang Qingyue's observation, if anger occurs during or after eating, it injures the stomach and spleen. The origin of liver-spleen disharmony, therefore, may be either an excess condition of the liver or a deficient condition of the spleen, or a combination of the two. One characteristic of this disharmony is the fluctuation in severity of symptoms with changes in the emotional state and tendency for either liver qi stagnation or spleen deficiency to predominate at different times. Liver 13, which is able both to regulate liver qi and to tonify spleen, is the main point on the abdomen to treat all gradations of liver-spleen disharmony, giving rise to symptoms such as propensity to anger, distension and pain of the abdomen, borborygmus, diarrhea, and loss of appetite. Diarrhea due to liver-spleen disharmony is distinguished by two main characteristics. The first is that the diarrhea is often preceded by distension and pain, both of which are relieved after passing stools. The second is that the diarrhea frequently alternates with constipation, for which this point is also indicated. This pattern is frequently encountered in irritable bowel syndrome and premenstrual bowel disorders. Liver 13 may also be used for spleen disharmony without liver complications, or liver disharmony without spleen complications. Throughout its action of fortifying the spleen, it is indicated for weariness of the limbs, emaciation, injury to the stomach and spleen from overindulgence in eating, and diarrhea containing undigested food. By resolving liver qi stagnation, it is able to treat esophageal constriction, fullness of the chest, focal distension, pain of the lateral costal region, and constipation. If liver qi stagnation leads to stasis of blood, there may be abdominal masses, and in terms of Western medicine, enlargement of the liver and or spleen. If liver qi stagnation transforms to fire, there may be agitation and heat with a dry mouth, mad walking, and propensity to anger. If the liver is deficient, there will be propensity to fear. If liver qi invades the stomach or lung and impairs their descending function, there will be vomiting, cough, or dyspnea. Through its dual action on the liver and spleen, liver 13 is also able to drain dampness or damp heat from the middle and lower jaw, with such symptoms as jaundice and frequent urination with turbid white discharge. The liver channel is interiorly, exteriorly coupled with the gallbladder channel, which controls the sides of the body and facilitates turning and bending. Liver 13, a meeting point of the liver and gallbladder channels, is located close to the waist and lumbar region and is indicated for rigidity of the spine, lumbar pain, and inability to turn and bend the waist. The Great Compendium of Acupuncture and Moxibustion recommends liver 13 for cold and pain of the lumbar spine, whilst Sun Si Miao in the 1000 Ducat formulas is more specific and recommends it for cold and painful lumbar spine in men. Liver 13 is finally indicated for the pattern of running piglet qi arising from severe stagnation of qi. According to the essentials from the Golden Cabinet, running piglet disorder arises from the lower abdomen. It rushes up to the throat with such ferocity that the patient feels he is close to death. It attacks and then remits. It is brought about by fear and fright. Running piglet qi primarily arises when stagnant liver qi transforms to heat, or when kidney yang deficiency leads to accumulation of cold in the lower jaw. In both cases, qi is violently discharged and rushes upwards along the penetrating vessel. In clinical practice, running piglet chi may be encountered in a number of variants, all involving a rushing sensation, usually upwards along the trunk, back, or limbs. It is usually accompanied by feelings of intense anxiety. Thank you very much for your attention.
Let's now discuss stomach and small intestine 6, or the support the Asian point, as part of our continuing studies on the she cleft or accumulation points. SI6 is located in the depression radial and proximal to the styloid process of the ulna, which forms when the hand is turned from a pronated to a supinated position. So how to find this point? This point is best located with the elbow slightly flexed. So we place the palpating finger on the distal position of the styloid process, and then when turning the hand from a pronated to a supinated position, we may use the mnemonic cat bread and eat soup to better recall this movement. So the palpating finger will glide into a bony cleft at the proximal aspect of the styloid process, which is the tendon of the extensor carpi ulnari muscle, which runs along this groove. This cleft also becomes palpable when the patient rests the hand on the chest in a half supinated position. We can locate SI6 on this bony groove. Okay. Needling SI6 can be done with a vertical or a slight oblique insertion, 0.3 to 0.8 tune deep in a proximal direction towards pericardium 6 or along the tendon towards the elbow joint. The actions and indications of SI6 are: it opens the channel, alleviates pain, benefits the shoulder and arm, and alleviates acute conditions. SI6 also benefits the eyes. As its special feature, SI6 is the she cleft point of the small intestine channel. It is an important distal point for pain and limited range of motion in the occiput and shoulders. For example, acute torticollis, and the lumbar region, for example, acute sciatica. For acute and painful impairment of motion, we use strong reducing needling technique while the patient gently moves the affected region. Here are illustrations of how to locate SI6 in a pronated and half supinated positions. Okay. As an accumulation point, SI6 is used for any channel problems of the small intestine, particularly acute cases with tightness of the sinews causing stiff neck and shoulders. Its effect on the feet is due to its relationship with the bladder channel within the greater yang. SI6 also benefits the eyesight, but only in patterns related to heart or small intestine. So in summary of its functions, SI6 brightens the eyes in blurred vision or eye pain. It also benefits the sinews. It removes obstruction from the channels in severe shoulder pain, severe pain of the upper arm, redness and swelling of the elbow, contracture of sinews, and in painful obstruction syndrome or the B syndrome of the feet. SI6 is the she cleft point of the small intestine channel. The she cleft points are where the chi and blood, which flows relatively superficially along the channels from the jingle points, gather and plunge more deeply. The she cleft points in general are indicated in the treatment of acute conditions and pain. SI6 is particularly used for pain of the shoulder, scapula, and arm that is so severe that it feels as they are broken or dislocated. This action extends to its paired TAIYUAN foot or bladder channel, and thus SI6 is also used as a distal point for acute sprain of the lumbar region and for contraction of the sinews and painful obstruction of the foot. The small intestine primary and sinew channels connect with the outer canthus, and the primary channel also connects with the inner canthus. SI6 is renowned for its use in deficiency type eye disorders characterized by blurring and dimness of vision. In most authorities explain the name of this point, support the aged in the light of this action. So we use SI6 in combination with other points. For example, for pain of the shoulders, as if it were broken, we combine SI6 with bladder 10. For pain of the lumbar region and knee, we combine SI6 with GB30, GB34, bladder 60, and bladder 62. For blurring of vision, we combine SI6 with bladder 10. And for dimness of vision, we combine SI6 with LI4 and bladder 4. Thank you for your attention.
Now we continue with the gathering points. Lung 9, supreme abyss. Lung 9 is located on the ventral aspect of the wrist at the level of the wrist joint space, most distal wrist crest, on the radial aspect of the radial artery and ulnar to the tendon of the abductor pollicis longus muscle. How to find? As the location of the wrist crest varies, the ventral joint space between the proximal row of the carpals and the radius ulna is a more reliable landmark for orientation. By loosely moving the hand, the joint space is easily palpable. Palpate the radial artery, pulsation on the radial side, and locate lung 9 on its radial aspect. Located on the same level are PC 7 between the two tendons and heart 7 radial to the insertion of the tendon of the flexor carpi ulnaris on the pisiform bone. Needling vertically 0.2 to 0.5 tune. Caution is to avoid the radial artery. If the needle is pulsating, the desired effect, no additional stimulation. For the action and indication, lung 9 strengthens the lung, transforms phlegm, descends the lung qi, regulates and harmonizes the vessel, relationship between song qi and blood circulation. Lung 9 opens the channel and alleviates pain. For the special features, U1 source point, Shu stream point, earth point, tonification point, meeting point of the vessels, important point for tonifying the lung qi and yin, especially with chronic disorders. This is another major point of the lung channel. It is the main point to tonify lung qi and lung yin, especially in chronic conditions. Being the source and tonification point, it is eminently suited to tonify the lung in deficiency conditions. We use it more frequently in deficiency rather than excess pattern and for interior rather than exterior conditions. However, as its indications show, it can be used also for excess patterns. It is also used to resolve phlegm, obstructing the lungs, but in chronic more than acute cases with such symptoms as chronic cough with sticky sputum. The chest is the seat of gathering qi, the song qi, which is closely related to lungs and heart. Lung 9 tonifies the gathering qi of the chest and can be used in patients who are particularly qi deficient, suffer from cold hands, and have a weak voice. These last two are signs of deficiency of gathering qi. When tonifying, gathering qi, lung 9 is often combined with Ren17. Okay. Lung 9 is also indicated when all the pulses are extremely weak and deep and nearly impossible to feel. An indication that is related to its function of controlling all blood vessels described below. Lung 9 is the gathering point of all the blood vessels. The classic of difficulties in chapter 1 says the inch mouth, the front position of the pulse corresponding to lung 9 is the great meeting place of all the blood vessels, and the lungs give impetus to the lungs. The front position of the pulse is considered the convergence point of all the blood vessels of the body, and for this reason, the acupuncture point on its site, lung 9, is said to influence all the blood vessels and the pulse. It is because of this nature that we feel the pulse on the radial artery, which overlies the lung channel. It is not by chance that this position was chosen as the best place to feel the pulse. It is because the lung governs qi, and one can therefore feel the movement of qi within the blood as this position. Lung 9 can therefore influence all blood vessels and can be used for poor circulation, cold hands and feet, chilblain, and varicose veins. The lung's influence on the blood vessel is a further expression of the close relationship existing between the lungs and heart. The lungs govern qi, the heart controls blood, and they mutually affect each other. Lung 9 tonifies lung qi and stimulates the circulation of heart qi and blood in the chest. It is therefore also used to tonify heart qi and blood indirectly in such symptoms as breathlessness on exertion, listlessness, and palpitation. Finally, lung 9 can be used to clear lung and liver heat in cases where liver fire overflows towards the chest, obstructing the descending of lung qi. Okay, for the summary, lung 9, for the exterior problems, for excess patterns, has an outward movement and affects qi. For the lung 9, for interior problems, for deficiency pattern, has an inward movement, affects qi and blood. Lung 7, for channel problems, better for emotional problems, good for acute conditions, opens water passages, affect bladder. For the lung 9, not so much for channel problems, not so much for emotional problems, more for chronic conditions, does not open water passages, does not affect the bladder. For the summary of functions, lung 9 tonifies lung qi and lung yin, resolves phlegm from the lungs in chronic cases, tonifies gathering qi, and therefore lungs and heart. Lung 9 affects all blood vessels. Thank you for your attention.
We continue with chronic fatigue syndrome, and today we will talk about the lesser yang pattern. Clinical manifestations, there are two types of pattern pertaining to the lesser yang channels. One from the 6 stages, from the discussion of cold-induced diseases by Chang Chongqing, and the other from the 4 levels, from the discussion on warm diseases by Ye Tianxu. They essentially describe the same pattern, the only difference being that the pattern from the 4 levels involves more heat. 6 stages. There is alternation of chills and feeling of heat, fullness of the hypochondrial region, poor appetite, irritability, dry throat, nausea, bitter taste, blurred vision, white slippery tongue coating on one side only, and a wiry pulse. From the 4 levels, alternation of chills and feeling of heat, the latter being more marked, bitter taste, thirst, dry throat, fullness and pain of the hypochondrial region, nausea, red tongue with yellow coating on one side, wiry and rapid pulse. Both these patterns describe a condition where the pathogenic factor occupies an energetic niche said to be in between the exterior and interior. Since the greater yang channels open on the exterior, the bright yang channels open on the interior. and the lesser yang channels are the hinge between the two. This pattern is called lesser yang pattern. The yang channels, being yang and therefore more superficial, represent the boundary between the human body and its environment. However, within the yang, there is a difference in energetic depth. The greater yang being the most superficial, the bright yang the deepest, and the lesser yang the hinge between the two. This could be graphically represented as a door, its outer surface being the greater yang, its inner one, the bright yang, and the hinge, the lesser yang. So here is a very good representation of the lesser yang, greater yang, and the bright yang. So as you can see, the lesser yang actually acts as the hinge. When the pathogenic factor is in the lesser yang, whether within the 6 stages or 4 levels, it can somehow hide there for a long time and become chronic. This cannot happen when it is in the greater yang or bright yang, where it is bound either to be expelled or to evolve into a different condition. The essential symptom indicating that the pathogenic factor is in between the exterior and interior is the alternating feeling of chills and heat. Please note that this is a subjective feeling of heat. This is due to the fact that the pathogenic factor bounces in between the exterior and interior. The patient feels cold when it is on the exterior and hot when it is in the interior. In many cases of chronic fatigue syndrome, when patients experience the alternating feeling of chills and heat for months or years, the temperature is very often subnormal. When the temperature becomes normal, the person feels better. The lesser yang pattern, characterized by alternation of chills and feeling of heat, is quite commonly seen in patients suffering from CFS. As was explained, this pattern is in itself a type of residual pathogenic factor, just as is dampness. The lesser yang pattern can even last for years. The longer it goes on, of course, the more it is associated with some deficiency. In these cases, it is necessary to clear the lesser yang before tonifying. Apart from the alternating feeling of chills and heat, another essential sign of this condition is the pulse being wiry. It may be wiry only on the left side, or it may be slightly wiry at the same time as being fine, but it should have some wiry quality. So treatment principle, clear the lesser yang. The points, triple burner 5 and do 14. Even method. Triple burner 5 and do 14 clear the lesser yang and release the pathogenic factor. They should be used several times in succession, obviously combined with some other points according to the condition. Thank you so much for your attention.